Welcome back to Today's Health. Today we're talking about recommendations for a healthy pregnancy with Dr. Stacey Tremp. Dr. Tremp, before the break we talked about the first trimester. Now we're talking about the second trimester.
Yeah.
What can you expect to happen at your doctor visits during the second trimester?
So second trimester, we're still going to see you about every 4 weeks until that 28 week and you go into that third trimester. We're going to listen for heart tones. After 20 weeks of pregnancy, we're going to start measuring your belly. And believe it or not, your uterus at 20 weeks is at your belly button. So we want to measure that to make sure it correlates to your weeks of gestation. So that's an important thing in that second trimester. Your blood pressure is going to be checked to make sure that you're not having any signs of elevated blood pressure. We're going to look at your urine and make sure there's no signs of protein or glucose in it. Protein can be a sign of problems with your blood pressure to come. And then glucose also, is there any sign of gestational diabetes, or is your body kind of giving us hints that you might be becoming gestational diabetic?
Now, what physical changes are expected during the second trimester?
Good question. So after 12 weeks of pregnancy, the uterus starts to rise out of the bony pelvis. So you'll start to see your little baby bump coming up. And 14 weeks is usually when most people will start to see it. If it's not your first pregnancy, you'll see it sooner rather than later. But you'll actually start to look pregnant.
Now, during the second trimester, what changes actually occur to the fetus, the baby?
So the baby will continue to grow in size and length itself. After 12 weeks, you know, that baby truly does look like a baby with arms and legs. And if you were to look at it, you would say it looks like a human more than anything. The baby will start to have hair and fingernails and things like that.
Just a really, really tiny human.
A really tiny human, yes.
So after you start to feel the first fetal movement, is it necessary to do kick counts, and how many should there be? How should that be done?
Good question. So most people will feel their baby start moving from 20 to 23 weeks. They'll start to feel really good movement, but it can be kind of sporadic up until 28 weeks. 28 weeks to 30 weeks, they can start feeling really good fetal movement, and there's charts that you can get, and we hand them out at our office about people, or to people, so that they can start tracking fetal movement. We should feel 10 kicks within 1 to 2 hours. And I always tell my patients, you know, babies have active times and they have inactive times. So it's important that we say we're not sitting down in the middle of the afternoon when we know that that baby's not active and trying to do our kick counts itself. So if your baby's active in the morning, see how long it takes you to do that kick count. Most people will tell me it takes them 15 to 20 minutes to get 10 kicks from their baby.
When should you expect to have testing for gestational diabetes?
So testing for gestational diabetes is typically done from 25 to 28 weeks. We do that glucola screening at 25 to 28 weeks. You're going to drink a sugary drink, and an hour later we're going to draw your blood. If you fail your gestational diabetes test, then we're going to move on to a 3-hour diabetes test. You're going to drink another sugary drink. We're going to measure your blood at intervals. So we want to know a fasting level, and then a 1, 2, and then 3-hour level to see if you truly have diabetes. The 1-hour screen is considered just a screen itself, and then the 3-hour would be considered a truly diagnostic test itself. It's important that we rule out gestational diabetes, because if we have a mom who's living at elevated sugars, that baby is then getting elevated sugars, and the weight of that baby can increase. That being said, at delivery, if you've had uncontrolled diabetes, your baby has been used to living at an elevated sugar level, then that baby could have seizures afterwards also, because now its sugar level is very low considered to what it was living with mom. So diabetes is an important topic, and it's an important thing that I discussed with my patients if they have failed their 3-hour testing.
What other testing needs to be done? Is there any other testing?
If your blood type is Rh negative, such as O negative or B negative, we try to do it closer to that 28-week mark, because we're going to give you a medicine called RhoGAM. It's an injection that we give you that protects you or the baby from your blood. If the baby has a different type of blood than yours, if you're, for example, I'm O negative, if my baby was O positive, my body would think that baby is foreign and try to attack the pregnancy. So by giving RhoGAM, it protects that baby, and also your future pregnancies. Your body won't see them as foreign either. That being said, if you're negative and your husband is negative, or your partner, there's no reason for RhoGAM, of course.
Doctor, this has been great information. It's time for another break. We'll continue in a moment.
Thank you.